Sentara Mid-Atlantic Cardiothoracic Surgeons has been at the forefront of Sentara's mission to improve health every day. We've been doing heart surgery since 1971, and the program has grown year over year, now doing over 2,000 cases a year. The Sentara Heart Surgery Program has long been recognized as a leader in the field. For 2 decades, we were in the U.S. News & World Report Top 50 Heart Surgery Programs, and more recently have been recognized as the Society of Thoracic Surgeons 3-star coronary artery bypass program. One of the strengths of the Sentara Heart Program is the interdisciplinary aspect of how we customize a patient's treatment plan. And whether it's in the coronary artery disease area, heart valve disease area, thoracic surgery or surgical oncology in the chest, the aortic center, and heart failure and transplant, it's a very multidisciplinary approach.
In 2011, we started our minimally invasive aortic valve program, our TAVR program, and since then we've grown to become one of the largest TAVR centers in the country. We really are able to give the full spectrum of treatment for aortic valve disease, from complex redo, aortic valve repairs, replacements, aortic root replacements, and the full spectrum of TAVR procedures as well. What we're trying to do is, people have heard of bespoke suits, but we're trying to come up with a bespoke valve replacement program, and we use all of the available tools that we have: CT imaging, obviously consultations with cardiologists and cardiac surgeons, and even advanced AI modeling, so that we can truly figure out what the best valve, whether it be a surgical valve or a TAVR valve, is going to be for the patient. And I think surgeons are the best interventionalists to be able to deal with this space, because they see it both from the inside, hands-on with surgery, and they also deal with it in the cath lab and the hybrid operating room as well.
In every aspect of what we do from a cardiac surgery standpoint, there is a multidisciplinary team behind that process. We have a weekly aortic clinic that all of the cardiac surgeons participate in, and we see patients for surveillance of their aortic aneurysms, and we have assistants with nurse practitioners who help run that clinic. In addition, we can provide one-stop shopping for the patients, where a cardiac surgeon, a vascular surgeon, and even an interventional cardiologist can all see the patient at one visit, so that we can look at every aspect of their disease process and decide what's the best way to treat their aortic disease pathology. We also focus on our Aortic Alert program, which is a system to treat the most significant and life-threatening aortic emergencies or acute aortic pathologies, such as aortic dissections. It provides the community at outlying hospitals or physicians that encounter patients with an acute pathology to reach out to us, and with one phone call can get everyone on the phone that needs to be to get that patient to the center here to get their aortic dissection fixed. So we provide a complete repair for most of our patients with very good outcomes, which we're very proud of.
And the power of the SHOCK program is that there is a one phone call system that they make, and they get a heart surgeon, a cardiologist, and an ICU doctor on the phone to discuss that patient with them. We're very fortunate now that we have an excellent heart transplant program with some of the best outcomes in the country. I think the most interesting thing to me, something that I'm involved in, is a navigation process for patients with heart failure. They're out there floating in the periphery until they get sick enough that they need someone like us. Rather than be a reactive system, it's a proactive system. Make sure they get the studies that they need, make sure they have the resources that they need, and make sure that they get the next level of care exactly when they need it. Our job is not just chip, chop, chip. It's to help patients navigate their journey of whatever heart issue they have.
The CHIP team here is really excellent. It's the complex high-risk interventional team, and they excel at taking care of patients who either don't have surgical disease or who aren't surgical candidates. And it's not always as simple as they're going to get bypass surgery, or we turn them down and they're going to get stents. Sometimes they'll place a support device for a very sick patient that then allows us to optimize that patient, make them a better, lower risk surgical candidate to where we can operate on them safely. And sometimes they'll intervene on a patient who is best served by their services but is in shock, and they're still in shock once they complete their intervention. And then we come back into the picture to place either ECMO or a left or a right heart pump and help manage those devices to get them through their problems.
We as APPs are with the patient from every step of the way, preoperatively, intraoperatively, and postoperatively, all the way through when they come back to see us for follow-up care. We hold their hands, we guide them, we teach them what might their obstacles be after surgery, during surgery, who's going to care for them. Make sure that their care is personalized and setting them up for success. What do they need at home to get back to what their standard of healthy living is? We are there at some of the darkest hours for patients and able to give them a second chance at life. So that just is such a great feeling to provide that for them.
There's a culture of excellence here and expertise that I'm very proud to be a part of, and I think it's reflected in how well our patients do and how happy they are when they get back home.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.